Good morning, everyone. My name is Carrol and I'm Head of Service for Cardiology, for those who don't know me. And on behalf of the multidisciplinary team, which is members here, I would just like to thank the Quality Improvement team for giving us the opportunity to present the work and review of our DC service. So, what is DC service, or direct current cardioversion? One may ask what it is and why are we doing it. It's external electrical shocks which are used to convert a patient who has atrial fibrillation into normal sinus rhythm. Atrial fibrillation is associated with 30 to 40% of our hospital admissions, and if untreated, it can worsen cardiac function, and the patient has a high risk of developing a stroke. So therefore, it's vitally important that when we carry this procedure out, that it's in a timely manner. So the background to this improvement is our service in 2013. It was managed by our clinical sister up in the ward in 1 North. She was allocated 2 hours per week to contact patients, educate patients and book them in for the procedure. The procedure was provided in 1 North day procedure room, and you know the increased demand on inpatient beds then attributed to this room being used, and then the patient was coming in for the procedure and the procedure had to be cancelled. So we were high risk, we had a high number of cancellations. This resulted then in the patients having to go back to the anticoagulant therapy. There was increased demands on the anticoagulant therapy clinics throughout Southern Trust, and we had patients waiting 9 months. It was all a paper-based process, so that led inevitably to increased patient complaints. So with increased patient complaints and increased waiting times, these were the drivers why we felt it was important that we need within cardiology to review our service. So we developed a multidisciplinary team which comprised of key stakeholders. We had medical, we had nursing, we had administrative staff from the booking centre, from our scheduling team, we had our operational support team, we had our pharmacy staff and myself from the management. So we started on a journey, and as you can see from the road, everybody comes with different dynamics and values, and at times the journey was up and down. But the 3 main themes that we concentrated on in this review was patient safety. Safety for the patient, but safety as well for our organisation. We wanted our service to be patient-centred, and we also wanted to see that it was effective. We used lean methodology in terms of we process mapped the patient's journey from the decision was being made that they needed this procedure right through to the outcome. So when we looked at patient safety, we met as a group and we developed a standard operating procedure so that our secretaries, when they got a confirmation this patient needed, it was very clear to them what they needed to do. We were able to create a day case waiting list and were able to monitor access. Our nursing and medical team developed an evidence-based protocol and pathways for our patient. We developed our patient information leaflets. But also in that patient, we had seen from Audrey this morning, it's not all about the information on paper. We also developed within our own service a pre-assessment service, and we had a pre-assessment nurse. And Mr McNally, you'd like to hear that this was all within our own resources of a team, so nothing extra.
Very good.
So this pre-assessment nurse provided face-to-face contact or a telephone consultation with the patient. It was the patient's choice. And they monitored, and they could monitor through linking in with the GPs and that the results of their INRs. Training. This is a procedure that was being carried out at level, so we needed to make sure that staff undertaking this was ALS trained, advanced life support. Our equipment, this was a defibrillator that we were using, so our nursing and medical staff were trained in this. And we have to continuously train because we have new medical staff coming every 6 months. We keep a register. Medical staff had to continue it was mandatory that they completed the e-learning on safe sedation module. We audit our practice and we audit the medications regarding safe sedation and how compliant we were with that policy. When we looked at patient-centred, how did we embark upon that? We listened to the views of the patients that were coming to One North, and we also listened to the staff in One North at that stage. And we knew that the things that was coming from the patients, they wanted this procedure in a timely manner. So we relocated the service from One North down to the catheterisation lab, and it's held on every Friday morning, 5 to 6 patients, whatever the demand is. Our pre-assessment nurse educates, supports and advises the patient. She contacts the patient and she gives them that choice. She also provides the patient with education regarding anticoagulant therapy, the pre-op care, what is expected on the day, and also the post-operative care. It's important as well, we introduced the patient questionnaire, and we're continuously reviewing the comments that we get from patients. So how did we see that our service was effective? Our waiting times have been drastically reduced. We have gone from 9 months to patients being booked now within 2 weeks. Increased patient satisfaction. Our questionnaires, the feedback has been very positive. They said excellent service, and some patients, these patients can present maybe 2-3 years later back into AF and need the procedure done. What a change. This is what some of the comments that the patients were making. As I said, we audited the use of safe sedation. We audited it, and unfortunately our first 6 months we had high use and we were non-compliant with our safe sedation policy. That was fed back to our cardiology governance team meetings, and we took aboard that, and now we have seen a 75% reduction in patients who have received greater than 5 milligrams. We also then looked at, well, what is our success rate regarding DC conversions? And our success rate is 95%. If patients, after 2 unsuccessful attempts of DC conversion, they're automatically referred by the pre-assessment nurse in the cath lab, and they're referred to our cardiac electrophysiologist, Dr. McEnany, who will see that patient and they will discuss about internal cardio device. I suppose for us, well, what is the focus for the future? Because we are still non-compliant with the safe sedation policy, we have linked with Dr. McAllister, and he has kindly agreed to come and speak to our medical staff in the use of maybe fentanyl as for safe sedation. I believe that we've developed this service, that this service can go one step further and become completely nurse-led service. I think our focus is to continuously review the service that we are providing, and I believe in this quote by Benjamin Disraeli: change is constant. In a progressive society, change will be inevitable. We've heard today that people, I suppose in this room, have all different perceptions of what quality is. For us and the team, we believe the team that we are now providing a service for our patients, that it's at the right time, it's provided by the right people, our staff are competent and trained, and now it's in the right environment. Many thanks.